Peptides BPC-157 and TB-500. Most likely, you've already seen videos on social media where people completely transform themselves using something called peptides. And you probably ask yourself, what exactly is this stuff? In this video, I'll help you understand what peptides are, why people use them, whether they have side effects, and how they are used in bodybuilding. Why do you need peptides? Peptides are commonly used to speed up recovery after injuries, strengthen tendons and ligaments, reduce the risk of injuries when training with heavy weights and high volume, and to improve capillary density. Main effects: tissue regeneration, healing of tendons, ligaments, and muscles, vascular growth, angiogenesis. If you heard about peptides before, you might be wondering, are peptides steroids? No, peptides are not steroids, but at the same time they are not approved by regulatory authorities and are banned in professional sports, excluding bodybuilding. It's important to understand that BPC-157 and TB-500 are not officially approved pharmaceutical drugs. Most of the available information is based on animal studies and the empirical experience of athletes, and the long-term safety in humans has not been fully studied. That said, in short-term observations serious side effects have not been reported, but there is insufficient data on long-term use. Now let's take a closer look at BPC-157 and TB-500. Those two peptides are most commonly used by bodybuilders to support recovery of the musculoskeletal system. BPC-157 is considered a favorite due to its broader range of effects. In addition to supporting joints, tendons, and ligaments, it also has a positive effect on gastrointestinal health. When it comes to TB500, this is a more narrowly targeted peptide that primarily works on tendons, ligaments, and the overall musculoskeletal system. It can indirectly contribute to training progress by improving recovery and also helps accelerate the healing of injuries. Now we can move on the part most people are waiting for: how to use these peptides. Before discussing usage protocols, you need to be fully aware of what you're doing. You should be over 80 years old and check whether these substances are legal in your country of residence. All dosages maintained are not clinical recommendations, but are based on bodybuilding experience. Peptide reconstitution. To reconstitute peptides, bacteriostatic water is typically used. Many people use sodium chloride, sterile water for injections. Yes, this is also acceptable, but first, it's not the most effective option. Since peptides degrade relatively quickly, and they tend to degrade much faster in sodium chloride solution. Additionally, injections are usually more painful. Bacteriostatic water not only makes injections less painful, but also helps preserve the peptide for a long period of time. As for storage, both dry and reconstituted peptides should be kept in the refrigerator, otherwise they will degrade quickly. After opening and reconstitution, the peptide can be stored in the refrigerator for 20 to 30 days in sodium chloride solution and up to 2 months in bacteriostatic water. Example: BPC-157. For reconstitution, you'll need a standard 5 ml syringe. Draw exactly 2 ml of bacteriostatic water. Insert the needle into the peptide vial and slightly pull back on the plunger to create a vacuum. The water will then flow into the vial on its own. After that, gently swirl the vial. Do not shake it aggressively, as this can damage the peptide. Let it sit for a few minutes until the solution becomes clear. Dosages. Based on bodybuilding experience. For body weight 100 plus kg, the daily dose is around 1000 micrograms. It's better to split it into two doses: 0.5 micrograms in the morning, 0.5 micrograms in the evening. If timing isn't an issue, you can also inject the full 1000 micrograms subcutaneously before bed. If you weigh around 50, 60, 70 kilograms, the daily dose is 500 micrograms. Now take an insulin syringe and draw 0.2 ml if you weigh over 100 kilograms, or 0.1 ml if you weigh around 50, 60, 70 kilograms. The injections can be administered near the injured area, or under normal conditions, subcutaneously in the abdominal area. You can rotate injection sites on the abdomen. Peptides are active in the body for several hours, which is why daily administration is considered the most effective. TB500 usage. The reconstitution method is the same. During the first week, 2 micrograms is used 3 to 4 times per week, and over the next 2 months, 1 microgram is injected twice per week. BPC-157 daily, TB-500 twice per week. How long can peptides be used? A long-term continuous use has not been fully studied. Based on the experience and recommendations of athletes, BPC-157 is often used without breaks, unlike TB-500, which is typically used in cycles of 2 to 3 months.